Hi. Recently, I have been asked by two people about how to control blood pressure without getting on blood pressure medication. And it occurred to me that sometimes people with high blood pressure fall into this place where they're not quite all the way hypertensive, like 150, 160 over 80 or 90. And sometimes they fall in this little space where their blood pressure runs like 139, 144 over 90, or 140 over 94. And that little space where you surely don't want to be hypertensive and ignore it. But yet, is there something that you can do that can switch things a little bit? So I have worked with two people recently, and one of them actually did all the steps that we had talked about. We met in person and we went kind of through all of her history. And when I was discussing with her all the different options about her blood pressure, I really like to think about it as a technique called PEMS: physical, emotional, mental, and spiritual. Because every disease is a conglomeration of things. And she was at a place where she really did not want to be on blood pressure medicine. She had seen her provider, and her provider gave her 2 weeks to kind of work on getting her blood pressure down and to be checking it at home and then bring her records back in. And so during that 2 weeks, we met together, and I started her on a couple vitamin supplements that are very supportive for the heart and very supportive for bringing the blood pressure down. We discussed all the different dietary changes. The biggest one was gluten, and she was agreeable to losing 1 pound a week. And then we talked a little bit about the heart chakra, because spiritually, hypertension, or tension, as the word indicates, is high tension in the body. And what is causing the high tension? And a lot of times in primary care, when, especially I worked there for 18 years and been a nurse for 35, I'd see high blood pressure all the time. Never did I think like, I wonder what the root cause, like why did somebody develop hypertension to begin with? And now for the last 7 years that I've been doing more functional medicine, I think that all the time, because our bodies have the ability to heal themselves. Unfortunately, we don't spend enough time on trying to heal ourselves. We accept the standard of care, which is to medicate the problem. But if the problem is hypertension that is coming from weight issues, salt issues, stress issues, insomnic issues, sleep apnea issues, as you can see, this is a big number of things, even lack of exercise. So if you think that there's a possibility that the root cause of what's going on with blood pressure is multifaceted, it's not just a medication problem, it's a lifestyle problem. Within 2 weeks, she went from 150, 160, 149 on the top numbers and 85 to 95 on the bottom numbers. She dropped down into 110 over 70 and 120 over 70. And some days she was even around 104. And on those days I said, maybe we should probably be rechecking them, because those are pretty low compared to where we started. Her commitment was she was doing more things to monitor her stress. She was writing down all the foods that she was eating, and she was completely off of gluten. That was my number one recommendation. She lost 1 pound a week for 2 weeks, and so she was doing all the work. Also drinking electrolyte water, which is a favorite of mine. A lot of times, like with high blood pressure, something we don't think about is how much water people are intaking. When the kidneys get dry, they make this thing called ACE. And this chemical squeezes the vessels so that the kidneys get more water. So sometimes it's a water imbalance, and that's so simple that we don't even think about it a lot of times, and we put people on water pills that reduce their water and helps reduce their blood pressure. I would never do blood pressure stuff without taking my medication or checking with my doctor. But I think the message here is that hypertension, just like anything else, it has many different things that can be going on. And when you're deciding about what you're going to do about it, hypertension needs love, needs diet, needs movement, sometimes it needs medication. Sometimes it needs some supplementing. There's lots of good supplements that help with the blood pressure. Magnesium is a good example of something that kind of is like a muscle relaxer. So it kind of relaxes our vessels a little bit. And vitamin D, almost everybody in the world is vitamin D deficient. You don't even have to test anybody. Every patient that I test at the office had a vitamin D deficiency. So I get tired of hearing myself say anything about vitamin D, but it has over 100 different receptors in the body, and we need it. And it's a precursor to things with mood and mood regulation in the brain. And it also helps with our thyroid. So again, like when you're thinking about how to monitor and do things for your blood pressure, one thing I tell patients, always have your own blood pressure monitor and be checking it at home. Always check to make sure that you're doing it correctly. And always bring your blood pressure cuff to the doctor's office so that the doctor can check your blood pressure cuff with their ears when they're listening and auscultating the blood pressure in the arm, so that we know that the blood pressure is correct at home. So that's the first thing. The second thing is really cleaning up the diet. I'm telling you, like, I am positive that her blood pressure did such a great response just getting off of gluten. A lot of us don't understand what gluten does exactly, but the gluten is not something that our body can absorb. And if the gluten is constantly beating up on our gut biome or the gut lining, eventually we can weaken the gut's ability to absorb appropriately, and things kind of sneak through into the bloodstream, which upregulate our immune system. So it seems silly to always be linking gluten with so many things, but if you have high blood pressure, you should be trying to link things together and get healthy, because nobody's coming to help you. And being on a medication for the next 30, 40, 50 years of your life, that's not an option for me. Not at all. It's just not anything that I'm interested in. And in order to stay healthy, that means that I am going to do the work to get me healthy. I'm not going to let medication be the only answer for what's going on with my body. And when you think about it, high blood pressure emotionally is connected to the heart. So is there places in your heart where there may not be forgiveness? There may be some issues with you're not able to open your heart, or maybe you open your heart so much, so often, that now the heart is just kind of retreating and having periods of sadness. And how do I address that? Well, I do breathing exercises. I like the breath of fire, which is and you do that for a count of 30 several times a day. Why does that work? Because as you're breathing, it is opening up the chakras all the way up to the brain. In the brain in the back, we have this thing called the pineal gland. And that breathing exercises opens up all the cerebral spinal fluid and reconnects the whole system inside, which is our energy system. So energy has as much to do with hypertension as emotions and depression and anxiety, as physical, as in diet, and then in mindset. Where is your mindset? Is your mindset in, well, I'm just going to have high blood pressure because it runs in my family. My mom had it, my dad had it, we all had it, so I have it. Or you can decide in your mind that maybe I don't need to have this. Maybe I can see this another way. Maybe I could make a plan to come up with that would actually help curtail the whole high blood pressure thing. You don't want to have high blood pressure because it is the root of evil in the body. It kills the kidneys. It pushes so hard against the blood vessels. It's often related to strokes and heart attacks. And if you could do some of that with diet, exercise, vitamin supplement, appropriate water management, doing some heart chakra work, or doing some meditation, wouldn't it be so much more worth it to start cleaning inside and getting rid of the inflammation? I mean, just think about it. I think it's worth it. And I hope you do too. And if you're okay with the medication, I would still encourage you to think about doing the diet and nutritional things that kind of help support your body, because your body is telling you something is wrong. The medication isn't fixing the problem. It is reducing or getting rid of it But if you don't take the medicine, the problem is still there, right? So hope you learned something today. I want to help a million people. If this did anything for you, please, please pass it on. Join me on Journey of You, my group Facebook page that I address any kind of issues that you're interested in hearing about. And I'd love to hear what you feel like you need, because right now I'm just feeding you the things that I feel like you need, which are not always the same, are they? All right, see you later.